Honestly, I I remember one course, and it's it started to break down the disparities between Black Americans, white Americans, and all that. And I really was like, okay, so now there's language behind all the things that I'm experiencing and hearing and seeing. And I think that really ignited my quest to explore what that looks like in different areas of public health. But I think just being in spaces where I was able to connect the dots or put words behind the feelings that I had growing up. Massachusetts and Boston is also predominantly white. So oftentimes I was the only Black girl in spaces. And just having public health articulate some of those concepts from the health perspective, I really appreciated that. I'm so happy that I made that switch.
That's very, very real because I feel like we do realize that there are these, well, we know it now as disparities and equities in life, but you can see that like there are differences in how people live and stuff like that. And it really wasn't clear to me until I got into my master's program just how like society and how we have built society has like created these types of issues within certain populations and in certain ways, which I think is fascinating, but also gives us, I think, a perspective and tools to kind of move forward at that community level and improve that population health.
Right.
And after you graduated from your undergrad, you worked at Roxbury Youth Programs, firstly as an educational program director and then as a director. Tell us about that first position after graduating.
Yeah, that was actually my first full time role after graduating. And first, I was the education program coordinator. And I remember creating programming that was specific to health and health outcomes, particularly around youth. In the Boston area, and really looking at intervention strategies, which was really, really cool, and challenging because, I'm fresh out of undergrad, and a lot of these high school kids could be very specific and direct with their words. So I remember doing one activity and they were like, "Miss, like that's not it." And I'm like, "All right, thank you for your honesty." So, um, I really that really made me, just because I have this degree, I don't have all the answers, right? My lived experience is completely different than their lived experience. So I can never and should never think that because I think this is the best thing for them to do, that they agree with that. So I started doing little, I forgot what they were called, but like check-in sessions when I would do things where I would hear their feedback. What is it that you want to see? What are some conversations you want to talk about? And a lot of them were saying they would like more resources around sexual health education. So I remember reaching out to a friend of mine, a colleague of mine, who was doing, I think, like youth sexual health work. And she came in and did a few sessions and was able to bring in some condoms and other sexual health materials for the young people. We did a consent form prior for them just in case. And that really started to get me thinking on what is my place in public health. And um, I also remember during that time, or while I was there, we had a large group of volunteers that would come in, and they normally lived in the suburbs outside of Boston, and we recognized very quickly that there were biases and privileges that were very prevalent when these volunteers would come in. And I remember my colleague spearheaded series called Courageous Conversations. And I just remember learning from learning from her just aura while she was leading these trainings, or how she communicated with individuals in this space. And it was hard to have these conversations with individuals because they're doing good. They're volunteering, they're doing, you know, homework prep, they're doing tutoring, they're even doing specific programming if they had little areas of interest where they would, I think one of them loved photography, so they do those things. But I just remember there was one volunteer in particular who, and this is what kind of sparked this, came up to me and was like, and this was normally for high school. One of the high school students had a younger sibling, and we allowed this younger sibling to come who was in seventh grade. And the seventh grader didn't have any homework to do. And the volunteer came up to me and was like, he should be so honored that I'm here to support him. And we were like, all right, well, we're going to have to reframe that and really address that and peel back the layers because this is a youth program. This is for youth. So anyone who works here or is volunteering or participates here needs to have an understanding that anything done, we're kind of under the direction of what the youth need. It should never be self-fulfilling. So I think that was my first exposure to like equitable practices in the workplace, and really upholding and maintaining that, not only for the safety of employees who are showing up with their different lived experiences, but also for individuals that we're providing services for, right? We're serving individuals and we need to make sure that the people we're serving feel safe and happy and welcome. So, to be exposed to that kind of out of college was another like unveiling or pulling the wool over my eyes or whatever the phrase is. And it was just eye opening that again, that there's so many complexities in the field of public health. And like, I just started loving it more and more and more and more. I'm really thankful for that role. And I think that organization's still around today. But they do and have done a lot of good work. And I think they really are intentional about making sure that they do the right thing.
I love that that you're able to get that experience and I guess be able to handle maybe a little bit of conflict or like just understanding how like we speak with people that we're working with and how we really have to show up in a certain way, which I think is very important as well.